Hello everybody, it's been a while, but I'm back. I had a bit of an adventure in the sense that I was tested positive for COVID and had to spend 2 weeks in self-isolation. So I couldn't get much done. Luckily I'm well, and I hope that you are well and safe too. Last time we spoke, we did an introductory chat on anxiety, and we made a couple of important points. Firstly, there's always some sort of genetic loading. In other words, if we look at families, we can see that there's a family history, although not necessarily always recognized by the family as being anxiety related. Secondly, we spoke about the processes in the brain, where I explained to you that it's a two-tier process, namely that we have the amygdala in our more primitive area of our brain, which receives a feeling of threat, and that's sent up to the neocortex, where we make an interpretation of what we think is possibly threatening. It does not mean that somebody else will see it as threatening. I also stress that if we have an overactive amygdala and a neocortex that's really struggling to process all the warning signals, we may end up making faulty assessments of what's really going on. I think often people that suffer from anxiety will find that during the course of the night they'll worry about all sorts of things, and then tomorrow they'll think, but what was all of that about? The third thing that was important from our previous discussion is that there's good anxiety. It's really, we can put it on a scale, because similarly your good anxiety has to do with characteristics that help you function in your particular profession or family life, like the chef. If he's not meticulous and perfectionistic, his food won't look particularly appetizing. But on the other hand, when anxiety becomes debilitating, that I'm shouting and screaming because everything is not okay, then of course I'm heading towards an anxiety disorder. What we're going to chat about today are the different ways in which excessive anxiety can present. That means anxiety to the point where it impairs your functioning at school, at work, within your family, and within your relationships with your fellow workers and so on. And here the word impair is very important. The first one we're going to chat about is something called phobias. And I have a specific fear that's irrational, although it still scares me, and where it can then cause me to have some sort of aversion. For example, I may develop a fear of beetles, or of lightning, or of the sound of the rustling of leaves, and when I'm confronted with that, I have this irrational anxiety reaction. And it's interesting that people that struggle with this know that this fear is completely irrational, but when it comes up, they can't stop themselves from responding with excessive anxiety. The second way anxiety may present, it's something we often find in children, and that's called selective mutism. That means that as a child, I will just speak to my family or a particular family member, but I will not speak to anybody outside the family. I may be willing to write down what I have to say, but it's exactly as the term says, that I select who I'm going to treat with being mute. And at the basis of that, of course, is excessive anxiety. So we have these children being able to chat within situations where they feel relaxed, but certainly it impairs them on a social and educational level if they can't express themselves. The third type of anxiety, which often we find in children, but can also occur in parents, is something called separation anxiety. And that's really just what it says. It means that the child is unwilling to separate from an object of care or love. And that the separation or the anticipated separation from that person or persons may cause a lot of distress. This may also include fears that something really bad may happen to the parent, where I anticipate that I may lose a parent, that I refuse to be away from home. For example, I'm not willing to go to school. As soon as school comes up, I'm either ill or I have a massive meltdown that discourages my parent to take me to school. It's also the child who doesn't really want to sleep out at friends or even at grannies or other family members. You'll often get a situation that you'll get a phone call late at night saying, please come and fetch your child. She's crying, she's hyperventilating, she's screaming, she wants to go home. And of course, that's what we call separation anxiety, because I want to be back with the people that I care for and that I know care for me. This child may also have nightmares about separation. And this state could also include certain physical symptoms, for example, nausea or headaches or stomach aches, and then I rush the child off to the doctor and there's an examination and the doctor says there's nothing wrong here. Child's tummy is fine. Sometimes the separation anxiety will get so bad that the child may actually have a panic attack, which means is a sudden surge of anxiety which creates immense physical discomfort on different levels, and we'll be looking at that a few minutes later. Generalized anxiety is something which is quite common in adults and in children, and in fact it's one of the most common anxiety related disorders that land up with the psychiatrist or the psychologist. It's important just to point out that extreme generalized anxiety can also trigger some level of depression. There's a link between the two. This condition is characterized by, firstly, persistent worrying. And if I try to stop the worrying, I am unsuccessful. And the worry that I have about this particular issue is often excessive to the real impact or meaning of the situation, where I may overanalyze, overthink what I've done or not done, and what the possible implications are, and what the worst case scenarios are, and where I'll play out different scenarios in my head, because I'm trying to find something that will help me avoid mistakes, because mistakes do not sit well with people who present with generalized anxiety. Often they are perfectionistic, rigid in their thinking, and they may have a very black and white approach to life. Another thing that's typical of your person with excessive generalized anxiety is they don't like change. They don't like unpredictability. They don't like a feeling of not being in control. And I think we saw this during COVID, especially in the initial 2-3 months of COVID, that people with this sort of temperament really struggled to find a new rhythm, because everything became chaotic, unpredictable. There were no clear rules, there was no clear strategy, and in the process of adjusting, many of them found it to be quite stressful. As an adjunct to the anxiety, this person may experience that I'm struggling to concentrate, or we find the typical thing of I go blank when I have to write an exam. That if I sit down and I look at this particular problem on the question paper, I can't even recognize it, and I obviously go into some sort of panic or excessive fear, or it becomes really overwhelming, and then I cannot remember anything of what I've learned. Often your person with generalized anxiety can tend to be a little bit keyed up, a little bit irritable, have feelings of tension, and there may even be physical signs like struggling to sleep, feeling tired a lot of the time, having stress headaches, feeling trembly or twitchy, that there's a lot of muscle tension in the neck and in the shoulders. And we may even have symptoms like nausea, diarrhea, irritable bowel. All of that goes with generalized anxiety. Of course, one may say that, yeah, we all have these characteristics, but of course not all of us have them to a point where they could be debilitating. And that's really the difference between the two. Is it debilitating? And that needs to be judged within the person's family system and the other systems within which he functions. Typically with your person with generalized anxiety, you may find two typical approaches. We spoke about the fight response. In other words, they may become controlling, argumentative, rigid, critical, self-critical, critical of others because it needs to be done the right way and only the right way. Or on the other hand, where the person will just submit to what's going on and then be over-accommodating, in the sense that if I can structure my surroundings so that I perceive other people to be happy, then I can be happy. So it's sort of both aspects, whether I'm fighting or fleeing, have a control aspect where either I control by being rigid, or I control by trying to create circumstances where I think others may be at ease, because that of course has a payoff for me, and in that way I can control my environment. A while ago when we discussed separation anxiety, we spoke about panic attacks and panic disorder. Now, the important thing about panic attacks is that there's a very quick escalation of anxiety to a point where it becomes really uncomfortable. Secondly, there's no specific trigger. So although the person, let's say he had a panic attack in a shopping center, now he starts avoiding shopping centers, he may also have a panic attack in his garage or in his car or in the bathroom, or there's really no association between an outside trigger and the occurrence of the panic attack. And the panic attack, as I've said, is a very quick rise of anxiety to a point where it becomes physically very uncomfortable and feels very threatening. Typically, the person with a panic disorder may experience some of the following features: that there's a sense of impending doom or death, that I fear that I may lose control, I'm going crazy, what's going on here, I don't understand it, I'm losing my mind. And then of course physically my heart's pounding, my heart rate's up, I'm sweating, I'm getting chills, I'm getting hot flushes, I have shortness of breath, feels like somebody's sitting on my chest. Also abdominally I may either have some general discomfort or very specifically diarrhea or nausea, vomiting. This could also include headaches, lightheadedness or faintness. In addition, I may experience either a sense of tingling in my, let's say, in my hands, or I may feel a sense of numbness, that my ability to feel seems gone. The other thing which can be quite scary here is that I feel like I'm detaching and looking in from the outside. Now, I'm not going to get into diagnostic issues, but obviously if you experience these features or some of these features, this could be indicative of a panic disorder. Then we get to social anxiety. Social anxiety really is a sense of heightened anxiety, awkwardness in social situations. Typically, this person may not like giving speeches, may not like leading meetings, may not like functions where he or she doesn't know people, don't like being in the spotlight, don't like being observed. And they often fear that they may be judged and assessed by others, and they are anxious about doing something that could potentially embarrass them. Also, it could include a fear of interacting with others, and that others may potentially see that you are uncomfortable. The consequent result is that this person will tend to avoid these situations which he or she perceives to be threatening, where I may embarrass myself, where I may be judged, where people may not like me, and where I would rather, not go out, either be at home with my family or one or two good friends. But I'm certainly going to try and avoid situations where I have to interact with strangers. The other aspect of this issue is that I may end up spending a lot of time assessing and evaluating my own behavior and saying, well, maybe I should have done X, or maybe I shouldn't have done Y, and I said this and this, so the consequences could be that and that, and then I end up with a negative judgment on myself as a person. Often a person with social anxiety will say, yes, but I have a poor self-image, which of course is actually the result of how I perceive myself due to the underlying social anxiety. A last aspect would be that I would sort of, in my mind, structure the worst outcomes should I interact socially. I'm expecting the worst to happen. The different types of anxieties: phobias, selective mutism, generalized anxiety, panic disorder, separation anxiety, and social anxiety. This gives you some idea, and it's not necessarily in little boxes. Sometimes there's aspects of various categories present in one person. It just gives us some sort of structure as to generally what sort of anxiety we can expect. Now, next time when we speak, we'll be chatting about a management model specifically focused on children, but also applicable to adults. And on the other hand, looking at what sort of self-care do I have to do in order to make myself as resilient as possible. And we'll also talk about potential red flags so that I can timelessly identify when my anxiety is increasing beyond an acceptable level. That's it for today. Now, if you find this series of presentations interesting and enjoyable and meaningful, please like them, share them, and also subscribe to the YouTube channel. To my mind, this is something a lot of people struggle with, and maybe this information could assist them in order to get some sort of context in terms of what they're going through. So, thank you so much for your time. It's been nice having you. I'm hoping that there won't be many upcoming disruptions, but if they do come up, we'll deal with them. But for everyone out there, for you specifically, stay well, stay strong, look after yourself, and I'll see you next time.